Implementation of the European Society of Gastrointestinal Endoscopy, ESGE, and European Society of Gastroenterology and Endoscopy Nurses and Associates, ESGE-ENA, sedation training course in a regular endoscopy unit. Introduction. In modern practice, endoscopy is rarely performed without sedation. However, the definition of standard of care is difficult. Clinical scenarios range from low doses of benzodiazepine to general anesthesia, the latter being used especially for therapeutic procedures. The endoscopic outcomes, i.e., detection of pre-neoplastic and neoplastic lesions, completion rates during esophageal-gastroduodenoscopy or colonoscopy, achieved with the administration of benzodiazepine alone or combined with opioid, are quite optimal, even though patients' experiences are not always adequate. For this reason, many countries have tended to use propofol, and several scientific societies have approved this practice. Compared with traditional sedation, propofol-balanced sedation, PBS, presents similar rates of adverse events, provides higher patient satisfaction, decreases the time to sedation and to recovery, and increases the quality of the endoscopic examination. Nevertheless, PBS performed by non-anesthesiologists, despite generally being considered a safe procedure, is still a matter of debate due to the present regulations. Recently, an Italian position paper clarified that propofol usage is limited to hospital settings, but that prescription and administration by an anesthesiologist is not required, according to some drug packages, thus overcoming medical legal issues. However, propofol may lead to deep sedation or severe adverse events that require cardiopulmonary support. Specific knowledge and skills are necessary within the endoscopy team, both physicians and nurses, to ensure safe sedation. For this purpose, the European Society of Gastrointestinal Endoscopy, ESGE, and the European Society of Gastroenterology and Endoscopy Nurses and Associates, ESGE-ENA, have recently published a joint position statement on a European curriculum for sedation training in gastrointestinal GI endoscopy. Sedation is a continuum of states ranging from minimal sedation through to general anesthesia. It is not always possible to predict how a patient will respond. Irrespective of the drugs used, non-anesthesiologist sedation, NAS, requires appropriate patient selection, use of an established protocol for drug administration, careful patient monitoring during the procedure, and criteria for discharge. Moreover, endoscopy staff should be able to rescue patients whose level of sedation becomes deeper than initially intended. This study analyzes our experience with NAS for endoscopic procedures in a community hospital after the implementation of a specific training program based on ESGE, ESGE-ENA recommendations. The aim of the study was to evaluate the occurrence of adverse events related to sedation after implementation of the training program. Methods. From January 2017 to August 2018, data from all consecutive endoscopic procedures in adults 18 years or older performed at the author's endoscopy unit were collected using an electronic reporting system. Results. All staff, physicians, and nurses completed the ESGE, ESGE-ENA sedation course. In total, 12,132 patients underwent endoscopic procedures, 10,755, 88.6%, of which were performed in a non-anesthesiological setting. Of these, about 20% used moderate sedation with midazolam plus fentanyl, and 80% used deep sedation with additional propofol. No sentinel, 5, 0.05% moderate risk, and 18, 0.17% minor risk adverse events occurred, all during moderate or deep sedation, and all managed by endoscopy staff without the need for anesthesiologist assistance. Conclusions. After completing the ESGE, ESGE-ENA sedation training program, the rate of adverse events was very low in the author's institution. The findings support implementation of the program in all digestive endoscopy units and inclusion in the curriculum for physicians and nurses to ensure safe endoscopic procedures.